So the screening, my nurse did most of the data collection work, and she did help us to put in all the recalls. So I have seen an improvement in the uptake of cervical screening, because when she put them into the reminders, patients keep getting reminders, and they actually turn up and say, I've never had the cervical screening done, but I got this reminder and I decided I should get it done. Like, it has actually improved uptake. Like last week I had so many cervical screenings, that more than I ever had. I think it's benefited the practice, also benefited the patients in particular, like in particular cervical screening, that patients, if we picked up early, it helps them. And also it helps the practice as well, I mean, in terms of preventative care. In the last week in particular, like one lady that came in for cervical screening, and it came back to, actually not last week, but 2 weeks ago, came back to show cervical intraneoplasia, well, SIN 2. So that means she will need treatment and stuff. Like, she didn't even know she didn't have symptoms. She didn't know that she had it. She never ever thought of getting the cervical screening done before. So I think it's just a good pickup of people who never think that they might have HPV and cervical cancer. It would be useful for other practice to get involved in quality improvement projects, to be able to identify certain weaknesses and be able to improve that, to help the practice and also help patient care. I think the PHN was very supportive with the nurse, and initially the practice manager who was working here. So they've learned a lot from being able to, we didn't know about PanCat software before this, so like my nurse is quite skilled at using it now.